Good morning, good evening, good afternoon, doctors, nurses, and pharmacists. I am DrChe, and today we will be doing speaking role play with one of my doctors. So it would be also helpful for nurses. This role play is for doctors, but would also be helpful for nurses. So first of all, as like real exam, we will be giving you, doctor, 2 to 3 minutes, almost 2.5 minutes to prepare this role play. So once you are ready, please let me know.
Uh, okay,
Your
sir.
time starts now.
Okay.
Yes, those people who have joined recently, this is just a speaking role play with one of doctors, but this would also be helpful for nurses. And this is preparation time, that is why we are silent.
Okay, sir. I'm ready. We can start
Are
now.
you ready? Okay, just let me start timer. Just those people who have recently joined us, this is just, a speaking feedback class. It would be helpful for doctors and nurses, for all of you. Okay, so if you can hear me, you can write something in the chat. So let me start recording, doctor.
Okay, sir.
Start, please.
Hello, good morning. My name is Dr. Lauer. I'm the treating doctor for today. And how can I help you?
Doctor, yes, I called, 2 days ago, And the problem is I'm calling because I'm here because
Mm-hmm.
my son is scheduled for flu vaccine and I have some concerns about the vaccine.
Okay, I'm really happy to hear that because vaccine is a good way for preventing flu. So, sir, can you tell me what are your concern?
Uh, Doctor, I have heard in many places on
Mm-hmm.
social media and these things that the flu
Mm-hmm.
vaccine is not safe for small babies.
Mm-hmm. Okay, I appreciate your concern. Let me reassure you that the flu vaccine is a safe vaccine. It has very little side effect, including fever, rash, runny nose, but the advantage of this vaccine is outweigh these few side effects. Am I clear?
Doctor, what are the benefits of this vaccine?
Okay, that's a very good question. Actually, this vaccine it prevents to get the infection, and also if you get the infection after this vaccine, it will be a very mild. It will not cause severe disease. Uh,
Okay, doctor, but I have heard that, doctor, that many children develop fever and some serious complications.
Okay, let me reassure you that the side effects like fever, rash are self-limiting and no need treatment. It's not something serious. But if you concerned about it, you can use a paracetamol syrup to decrease the pain and fever. Uh, am I clear so far?
Okay, 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 doctor.
So do you have any other concern?
No, doctor, just I wanted to ask, my son has allergy to egg.
Mm-hmm.
So is it okay he can get a vaccine or no?
Okay, that's a very good question. Let me reassure you, Mr. This is the allergic reaction, severe allergic reaction in this vaccine is very rare. And if it has happened, then our staff is well trained to deal with severe allergic reaction. And I would like to reassure you, the allergy to egg is not the contraindication for this vaccine. Does it sound clear for you?
Yes, doctor, but I have heard that, sometimes I have heard in the news that many,
Mhm.
some children develop, severe allergic reaction and sometimes, it is lethal.
Yes, I appreciate your concern, and I would like to reassure you that the severe allergic reaction is quite rare. And if it happens, our staff is very well trained to deal with this condition, and your child will be remain under our observation until the risk for severe allergic reaction will decrease. Then you can go home.
Okay, okay, doctor. Uh,
So,
uh,
any other concern?
yes, doctor. Uh, Actually, doctor, due to my belief,
Mm-hmm.
we cannot use, pork contents of the vaccine. I have heard that this vaccine contains pork materials.
Mm-hmm.
So, so we are Muslims. We are not allowed to use the pork contents.
Mhm, mhm. Okay, so let me explain it to you that the vaccine in the form of nasal spray contain this pork, but the injection form does not contain this pork. But if the pork is not contained, so the vaccine will be less effective. That's why we prefer the vaccine with the pork one. Am I clear?
Okay, okay.
Okay, do you have any other questions?
No, doctor, thank you.
Okay, thank you, and I hope your child gets better soon.
Thank you, doctor.
Thank you.
So, doctor, overall was good.
Okay.
Okay, so
Actually, I forget to ask the name in the middle of
so
meeting.
yes, because you are saying sir, okay?
Yes, that's
And yeah, somebody is asking on Facebook, are you Kurdish?
yes, I'm Kurdish.
Yes, I think they from the name or from accent,
Maybe,
somebody has, you have pointed
maybe.
out. Okay. Okay. So first of all, doctor, one of the important things is to build good rapport with the patient.
Mm-hmm.
Okay.
Okay.
So I am the father of the baby. You maybe, in the real exam, you get mother. So first of all, you need to build a good rapport with the patient. Okay.
Okay.
With the attendant, with the mother or father.
Mm-hmm.
So, for example, here you are not using the name of the patient throughout your role play. You are saying sir, okay, sometime
Yes.
one or two times.
Mm-hmm.
If at some point, for example, after first question, you remember that I forgot to ask name. Okay, Mr. Just let me. Sorry, I forgot to ask your name. Could you please tell me how can I call you? You can see you can come back. Okay, if you forget at
Mm-hmm.
the start, you can do at the second point, third point. This is not a big issue. So once you come back to the point, that is not any big issue. Okay. So first,
Okay.
let me go to the last point that I remember well. That was the recent one that you have. First of all, my concern was, doctor, we cannot use poor contents of the vaccine because due to our religious belief. Okay. So your
Mm-hmm.
answer, you are just reading what is written on the role play.
Mm-hmm.
Let me explain you. The nasal spray contains porcine gelatin, that is poor content, and injection form does not contain gelatin but is less effective. You're just reading like this, okay?
Okay.
We need to make the things easy and clear for the reader, for the patient, okay? For the father, for the mother, for the parent. Okay. So
Okay.
first, what was the concern of the patient? The
The
last one.
patient. Okay. He heard like this vaccine contain pork protein. That
Yeah,
was
pork proteins,
patient.
okay, pork content, okay.
Yes.
So what he told, why he cannot use? Due to religious
Um,
belief, okay.
okay. Okay.
So first of all, you will say, Mr. Smith, let me tell you that we respect all the religions, and we respect your religion also. Yeah, yeah. When you say this, patient will get happy. Okay, yes
Mm-hmm.
or no?
Yes, that's right.
So Mr. Smith, we always respect your religion. And let me tell you that this vaccine comes in two forms. One is nasal spray, and other is in the form of injection. The first one that I told you, nasal spray, definitely, as you told that is true that you told it contains pork proteins.
Mm-hmm.
But let me tell you that the second form of injection, that is in the that second form of vaccine, that is injection, it does not contain any pork content. So,
Mm-hmm.
according to your belief, if you don't like pork contents, you can go for the injection, but it is a little bit less effective than the nasal spray.
Ah,
You can
okay.
see it's the same explanation.
Yes.
Yes or no? It's the same explanation.
Yes.
But
With
now,
some
if you
other.
tell like this, it would become very clear for the reader. If you say like this, okay, okay, sir, let me explain you. The vaccine is in the form of nasal spray. It contains porcine gelatin, pork protein. Injection form does not contain the gelatin, but less effective. So it's like robot is reading from the book. Yes or
Yes,
no?
that's right. That's right.
Okay. Now, can you explain this point again?
Okay. Uh, Mr. Smith, let me explain to you that this vaccine is in two forms.
First of all, Mr. Smith,
Mhm.
let me tell
Okay.
you that we respect your religion.
Ah, okay.
Uh,
Okay. First of all, Mr. Tamiz, let me explain to you. Okay, sorry. First, you have to talk about the religion, then the other.
Yeah, yeah, we respect your religion and then explain it comes in two forms.
Okay, Mr. Smith, we respect your religion and all religion, and I would like to explain to you that this vaccine is in two forms, in nasal spray form and in injection forms. The nasal spray form contain the pork protein, and the injection form does not contain this pork protein. So you can use the injection type because as you concerned about the pork protein is not contained, but I would like to tell you that it is less effective than the nasal spray.
But a little bit less effective, not too much less effective, okay?
Okay.
Then, then you can add a little bit, as you told me that this vaccine contains pork proteins. It is true, but only the nasal spray form contains this. The other
Mhm.
form, that is injection, does not contain. So when you take the opinion of the patient in your answer, it becomes more strong. Your answer
Mhm.
becomes more strong, okay?
Okay.
And the patient will get happy, okay? So first of all, when I started, I told you that I'm here because I have some concern about vaccine. So you started, I am happy that this and that. I think there was no need to start like this, happy. Okay. Mr. Smith,
Okay.
we are here to discuss about your concern. Please don't worry. And uh, and thanks for sharing your concerns with us. Could you please tell me what exactly, why you are concerned about flu vaccine? Because at the start, I only told you that I am concerned about flu vaccine. So you need to ask me what
Mhm.
exactly is my concern. So then ask my concern, then address that, and don't read this, but advantages outweigh disadvantages. This is just, a formal way. You need to make it easy, okay?
Mhm. Okay.
And for example, you can say, Mr. Smith, let me tell you that, this flu vaccine may have some, you know, some uh, just a few side effects like some light or some, you can say by mild side effects like, low grade fever, a little bit rash, or sometimes runny nose. But Mr. Smith, let me reassure you that the advantage, the benefits of using this vaccine are much more than these side effects. You can see this is a disadvantages. I am using these side effects, benefits instead of advantages, and instead of outweighs, little bit, the what I should say, formal terms. So you should use simple terms. Okay.
Okay.
Here was okay. If there is side effects, like as you told me, that is true, Mr. Smith, that it could develop into some, it can cause some side effects like rash and this and that. But let me tell you that these side effects are self-limiting. And most of the times there is no need of treatment, but even if there is pain or fever, you can give paracetamol syrup to your baby. Okay. And this was also okay. This explanation was good. So overall, Dr. Dilawar, the main thing is that you don't need to read what is written. You can use that information, but use your own language. Use explain the things in such a way that is easy for the reader to understand what is happening. Okay,
Okay. So
so
shall I do
make things,
paraphrasing, Doctor?
yeah, paraphrase, but in simple and easy language.
Okay. Okay.
And make things, sequencing. First of all, let me tell you, first type of nasal spray is, first type of vaccine is nasal spray, and there is another form that is in the form of injection. Like this is sequencing. So these things are, important. And when patient is concerned about something, just explain in very a good way. Okay. Some grammatical mistakes were also there. uh, Prevent, there was something singular, and you said prevent. So for example, this vaccine prevent, no, this vaccine prevents with S. Okay. Uh, get infection is, we can say, okay, mild we can use. If it is happened, no. If it happens, okay. If it happens, use present simple, okay. If it happens, then you can give, our vaccinating staff is, well trained to treat. Instead of deal with, you can write treat, okay, to treat this kind of allergic reaction. So they are well trained in case it appears. But let me assure you, this type of allergic reaction is very rare. Mean the very not used two times is rare, and but even if it appears, if it happens, if your son gets this type of reaction, then our vaccinated staff is highly trained to treat this the type of side effect, okay, like this. And yeah, so something like that. We need a little bit improvement. Your English is not bad, just we need to make things polish, things to improve. So now let's move to next role play. Yeah.
Sir, but can you like explain to me how, yani, what shall I do when I'm preparing a card in the 3 minute
Yes,
time?
that is good question. So for example, if first of all you need to read it quickly, okay? Means in the real exam you will have in front of you, if you're taking, face to
Yes.
face. I think
Mhm.
yours is online. Just you can just underline, if it is possible, underline the keywords. Okay, read the total complete, role play. Just underline the main words that you will explain. Reassure. Here is the reassurance about what the vaccine is safe. Okay, so this is the main. Just underline advantages, disadvantages. Okay, then you can hear what to do. What to do if side effects. Okay, this is what to do is in the bracket, but here the main thing is what to do if there is side effect. So here is a severe allergic reaction. If there is severe allergic reaction, so what could happen? Okay, and then this is, the form of vaccine. So the main thing is you need to keep in mind this background. This is the background knowledge. You will use this to explain, okay, to explain these things in the bullet points.
Mhm.
And
Yes.
other thing is just think how you will answer anything, how you will paraphrase if you have time. First, you need to read it complete, okay? And while we are doing role play, we can see the card, okay? This is not something that you need to memorize the questions.
Yes.
Okay, so now let's move to next. This is your second role play. While there is preparation time, we will be silent because the student need to prepare. Okay, the people on Facebook, please don't think that we are offline or there is problem with voice. Just we will be silent because he will be preparing. Okay, this would be preparation time. So, doctor, this is your role play. 2.5 minutes to prepare, please.
Okay, sir.
Those people who are with us on Facebook, you can also prepare, and you can see what you will do, okay, when you will see this role play.
Okay, so we can start.
Okay, let me start the recording and timer also. Start, please.
Hello, good morning. My name is Dr. Laur. I'm the treating doctor for today. And how can I address you, please?
Yes, doctor. I am Jenny.
Okay, nice to meet you, Jenny. And how can I help you today?
Yes, doctor. I'm here about my mother.
Mm-hmm,
She is 90-year-old and she was admitted here.
mm-hmm,
Actually, she was not eating well and she was having some other issues also. I'm
mm-hmm,
just here to ask about her condition, how she is doing now.
mm-hmm. Okay, I appreciate your concern. I'm really sorry to hear that. Before we proceed, can you tell me more about your mother's condition, please?
Yes, as I told you, doctor, she was, she is diagnosed with dementia, and
Mm-hmm,
recently she was not keeping herself well,
mm-hmm,
and she was refusing feed. She forgets to eat at time, and
mm-hmm.
she was losing weight. And doctor, I'm really concerned about my mother.
Okay, I'm really sorry to hear that. Uh, is it okay if I ask you a few more questions?
Yes, please, doctor.
Uh, does your mother has fever?
No, doctor.
And you mentioned she's not eating or drinking. That's right.
Yes, doctor.
Okay, Jenny, based on what you have told me, I suspect a condition called severe dementia. Have you ever heard about this?
Uh, Yeah, my mother has dementia, but I don't know too much about why it is severe dementia. No.
Mhm. Okay, let me explain it to you that severe dementia uh, is a is a syndrome in which there is a deterioration in cognitive function. It means there will be deterioration in, first of all, thinking ability, then the memory. It also affect the attention. And the last one, which is the most important one, is affecting logical reasoning and other mental abilities. Am I clear so far?
Yes, doctor, but I'm really concerned about her because she is not keeping herself. I don't know what should I do, doctor.
Mhm. Okay, I appreciate your concern. And I would like to, uh, I suggest to take your mother to home uh, for uh, for a palliative care at home. Uh, have you ever heard about the palliative care?
No, doctor, what is this?
Okay, palliative care, we give a patient when there is we cannot start any aggressive treatment. We cannot give too much treatment. All we have to do is to relieve the pain, and we give other supportive, like giving fluids and giving food by injections. And that's palliative care. Do you think you can do that?
Uh, doctor, actually, I'm alone at home. It is very difficult for me. But why you people are not, admitting her in the hospital? Just keep her in the hospital. So once her condition improves, I can take home, doctor.
Okay, I appreciate your concern. I would like to explain it to you, Jenny, that the consultant doctor decided not to give aggressive treatment because of the severity of the condition. It is severe dementia, it gets to the advanced level, and unfortunately, she will not get benefit from aggressive treatment, and it causes the condition to be more deteriorated. Am I clear?
Yeah, yes, doctor.
And Jenny, I will offer a social service and support group for further helping. As you mentioned, you are alone at home. That's
Uh,
okay.
that that would be good idea, doctor, because I live alone and I also struggle financially to take care of my
Mhm.
mother.
Okay. Jenny, do you have any other concern?
No, doctor, thank you.
Okay, thank you, and I wish you a speed recovery for your mother.
Okay, thank you, doctor.
Mm.
So first of all, doctor, there is no need to repeat again and again. I appreciate your concern, and I'm really sorry to hear that, because these
Mhm.
are memorized phrases. Okay, people
Yes,
learn
that's right.
from YouTube and from many online these substandard classes.
Yes.
So I'm not saying it is wrong, but mostly we can use at one time, okay, but not overuse these things, because overall it would not improve our score. Okay, instead we will
Mhm.
lose marks. Okay, not use this again and again. Okay,
Okay.
so furthermore, here my concern was aggressive treatment. Please admit and treat her in the hospital. Okay, you said I appreciate your concern. So can you think something else instead of saying uh, I appreciate your concern?
Okay. I appreciate your worry, or
No,
that's a
just
good
this is the
point.
same thing.
That, okay, that's a good point or good
First of all,
question, maybe.
first of all, praise the daughter. Okay, what we can use then? Okay, so this is the question. Okay, so for example, so my concern, first of all, as you can see, I am daughter and I'm really worried about my mother's condition. Okay,
Okay.
so you can appreciate Miss Jenny. I can you need to use my name also, because you asked my name at the start, then you forgot about my name. Miss Jenny, I can see that you are a caring daughter. Okay, and and you want your mother to be cared here in the hospital. Okay, so you can see this. This is
Mhm.
why this was my concern, and now I'm using different language. Okay, to
Mhm.
show that I am concerned and I want treatment in the hospital. Miss Jenny, I can see that you are a caring daughter and you want your mother to be admitted here for best treatment. Okay,
Okay.
but let me tell you that in according to her current condition, aggressive treatment, active treatment, aggressive treatment would not be helpful for her condition. And being in the hospital, there is she can get some infection that would be you know that would be not good for her. Like this, you can add things like this. Okay,
Okay, sir.
so use simple language. Appreciate, okay, appreciate the mother, the daughter, because she is really worried about her mother and she wants good care of her mother. Okay, appreciate. Okay, so here when you were using I'm really sorry, I'm really sorry again and again. So first I will say at one time is okay. uh, Miss Jani, first of all, I'm really sorry to hear about your mother's condition. As you told me, she is not eating well. Okay, and she is losing weight. You can add the the main symptoms to explain that you are really sorry. Okay, okay, and then could you please tell me a bit more about your mother's condition
Mhm.
or your mother's symptoms? Then she will tell this and that. Okay, you can add one as you asked about fever. That is not a problem. You can ask. Okay, or you can ask since how long she has been diagnosed with dementia, because now it is advanced. It means
Mhm.
she was already diagnosed with dementia. Okay,
Okay.
so since how long she has been diagnosed with dementia? Doctor, more than 20 years. Okay, I can see it is quite a long time. And here one thing I just came in mind that okay, so as I already told you here, I am the only mother. I am taking care of my mother. I'm only daughter, and I live alone. I am taking care of my mother. This before offering social services and further help, you can ask me, Miss Jenny. You told me that you live alone and you are the only person who takes care of your mother. Could you please tell me how you are coping with this? Okay.
Okay. Mhm.
No, doctor, it is not easy for me because I need to work, I need to do this. Okay, Miss Jenny, please don't worry. As you told me, you are the only person who takes care of your mother and you have to work also. So we have alternative options for you. We can offer you social services, and I can also introduce you to the some sport groups that would help you in taking care of your mother. You can just reading, okay, so Miss Jenny, we can offer you social services and sport groups for further help. This is just reading what is written there, okay?
Okay.
So as you know, for social services and sport groups, why we are offering this?
Yes, to help the patient for palliative therapy at home.
Because the patient, the mother, the carer who is the daughter is not able to deal with the care of this dementia patient, okay, and she will mention you. I have already mentioned you in the last before this that I am only person who takes care and this and that. Then you can use this before you offer this, so that you still had almost 20 seconds at the end when you missed, when you directly answered this. So you could have used that 20 seconds.
Mm. Okay, okay.
Okay, so for again here, you don't need to say a syndrome because this is for medical term. This is a condition. Okay, you don't need to use syndrome term. Why I'm using this term just as a medical term? So jargon syndrome is a little bit like a jargon. This is
Okay.
a condition. This is a condition in which there is, progressive. You can use some own knowledge also. There is progressive deterioration of our ability. You don't need to use cognitive because in the bracket is what is cognitive function. Okay, so you don't need to first say cognitive and then explain. You can do it, but I will say better. This is a condition in which there is progressive deterioration of our ability to think, and especially the patients of dementia have problem with memory. So it's a problem with memory, and then you can explain a little bit. They forget things, as you told me. She forgets to eat, and so sometimes they forget to eat and they forget to go to washroom like this.
Mhm. Okay.
Okay, so then stop here and then use in two terms, two two chunks, so that it is easy for the patient to understand. Sometimes they have difficulty in their daily life activities. Okay, so sometimes they have problem with attention and logical reasoning like this. You can use things like that. Okay,
Okay, sir.
so again you have used, I appreciate your concern here. We gave, okay, so some pronunciation problems. There were, okay, based is based. You said some best said like this is based, and some pronunciation with fluids, based and fluids. There are some two pronunciation issues,
Mhm.
and okay, like these things. Overall is good. Just we need a little bit more improvement. Okay. Do you have time for one more role play, or is enough?
Uh, no, wallahi, sir, I have to go right now because of the
Okay.
duty. Yes,
Yeah, on the duty. Okay. Okay, the
yes.
two is enough. And after duty, you would be available at what time?
Maybe I'll be available at night.
How many
Maybe
hours from now?
now it's 2:45. So I will be free after 4 p.m. On your time.
Okay, 4 p.m. UK time. Yeah.
Yes.
Okay, okay. So once you are available, just let me know so we
Mhm.
can do at least two role plays because your exam is just after 3 days, 2 days, I think so.
It's on, yes, yes, on
So you have
28.
only 2 days, so we can do one or two role plays after you are free from your duty. Okay. Thank you so much.
Okay, sir.
Those
Thank you.
people who are with us on Facebook. So if you have any questions, we have reading class. Dr. Glover, yeah, you can leave. No, I will just discussing some things
Okay,
with
sir.
you.
Thank you. Thank you.
Thank you. So we have reading class on Tuesday at 4 p.m. UK time. So if any of you is ready, okay, for that class, and apart from that, we have VIP hybrid course for writing, and we have speaking feedback. Speaking feedback is like this, face to face, directly with me. with my students, and we have writing course available also, and we have free classes. So what you need to do is please just, inform your friends who are also taking the same OET exam, and like my page and follow, and also just invite others to join the free classes. Thank you so much, all of you.